Dr. Tucker, and today we're going to look at our trigger point workshop. This class was designed to be a home care class to get you a little bit more proactive on the home front, to get you to do some pressure points, kind of to help you progress with care a little bit faster. So when we're done with the first part, the second part is going to show you how to understand some basic health concepts as part of our educational process in the office. Now, the first part is an area where we perform these things called trigger points. So if we're working on our trigger points, we want to know what they are. Now, trigger points are typically those tight spots that we're trying to dig out. They're collections of knots, essentially. So where you get those little lumpy spasm points, they're known as trigger points. Now, the question is, how do they come about? They usually result due to some irritation at the nerve, sending a signal to the muscle to contract. Now, what happens is we develop this cycle. The cycle essentially means you have an irritated nerve sending a signal to a muscle, causing the muscle to contract. That contracture will pull on the spine, potentially shifting out of position, further irritating the nerve, and ultimately creating this vicious cycle where tight muscles pulling the spine, spine out of alignment, irritating the nerve, irritated nerve sending a bad signal back to the muscle. Now, if you treat the muscle spasm alone, usually you're only going to get a temporary result. So you want to work on both. So what's an example of a temporary result? If you take a medication like a muscle relaxer, you're just temporarily masking that spasm. And then when you wake up, if the root cause of that nerve irritation is still there, you still have that spasm. So for people who have never had any hands-on experience, it's going to be nice to get a little practice, and it's going to help you hopefully feel a little bit better. But for those who've never had anyone poke around, it's also going to be not just therapeutic, but diagnostic. So if I poke around someone's left shoulder and I find one knot, well, that's reasonable, not a whole lot going on possibly, something small. Now, if I shift over to the right side and I start poking around on somebody and I find, 4, 5, 6 knots, larger in size, the patient's pretty sore to touch on there, then I know, okay, something's going on the right side of their body that's not happening on their left. There's an imbalance. So let's look at some of the more common trigger points, because we have, around 640 muscles in the human body. We can't touch on all of them. So the first area we're going to look at is going to be upper. Now, who's going to want to look at the upper trigger points? This is going to relate more to the patient with headaches, maybe numbness in the arms, obviously neck pain. So you have a few big points. There's a couple that are under your skull. There's a few right in the middle of the neck area, just off to the sides of the spine. And then you have the big muscles in your shoulders called the trapezius muscles. So these red dot pathways are where you're going to want to kind of poke along later on and look for areas of tightness. Now, for the lower back, if somebody has obviously back pain, hip pain, buttock tightness, sciatica, numbness in the legs, more likely you're going to find trigger points down below. So in this case, you're going to see these paraspinal muscles, again, just outside of the spine. They might be tight. Maybe some gluteal trigger points. Or off to the side, even further, closer to the hip, might be the piriformis muscle. So typically when you're working with a partner, the main thing you want to know is that you're not causing them any harm. So when you poke around, you're just going to look for any spots that are tight or tender, but the pressure you're going to apply, you want to make sure it's something they can tolerate. There's got to be some good communication. And when you find those spots and you're really comfortable that you're on a spot that the person feels you're treating and you feel feels hard, just make sure that when you're applying pressure, you're simply getting them to feel less pain. You don't want to dig so hard as to cause significant soreness. So you're not really trying to work, 20 years of tightness out in, just a few minutes. You want to be able to sit on it for just a little bit until it feels like it's a little less tight, a little less sore. So as long as the person says, hey, I feel a little less pain, then you're done treating that point, move on. At least until you've had a few sessions under your belt and you feel more comfortable. So if someone is doing this for the first time, you're just kind of counting on someone at home, a layperson, to help you poke around, massage these muscles a little bit. However, keep in mind, if you find a bunch of trigger points, a bunch of sore spots, this in itself is an indicator to possibly get a more extensive checkup somewhere, obviously like a chiropractic office. So before we start poking around, I'm going to demonstrate a few basic things. I'm going to have our Dr. Bowman come on up for a sec. And if you can take a seat for me, please. So if I'm working on, let's say a shoulder, neck area, he's an upper guy. When I'm poking around, I only need to apply enough pressure that I feel a little less irritation, and that shouldn't take too long. So typically, trigger points for the most part will fade pretty quickly. On average, they say about 10 to 30 seconds. So if I have, 4 trigger points that I find, I'm really just going to commit about 2 minutes in total to address those 2 points. Okay, now that I find a pressure point, I want to apply a little steady pressure. I'm not doing some sort of broad stroke massage. It's simply applying pressure at one point. I start light. I'm listening, looking for any body language issues, pressing a little harder to what I feel his tolerance is, and then he'll give me some feedback in terms of like, that's enough. How are we doing?
Great.
How about now?
Strong.
Okay, so I'll leave it. Okay, now that we've done upper trigger points, let's take a look at a few below and how to manage it ergonomically. So if someone has back pain, leg pain, sciatica, or numbness in the legs, they're going to want to look at the lower trigger points. So if I just have a chair, I would probably have them stand, so come on up. I'll scoot behind them. I would take a seat, so that way I don't have to hunch forward, and then I can poke around and look for trigger points. If you happen to have a bed or a bench nearby or something you can lay on, then it might be easier just to have them kind of come down on their belly. And there's usually a few trigger points here we tend to look for. In the spine, you can continue going down those paraspinal muscles and see if you poke around and anything just outside of the spine feels a little tight. So 2 parallel bands of muscles, you're poking along, find one, again, same steady pressure. Then you can work your way down a little bit laterally towards the glutes. You'll poke around the upper glute muscles, you'll see if you feel anything, same thing. And then you'll go out a little further down and out to the piriformis muscles by where the hip heads sit. Once I find something there, I can again set a steady pressure and hold. The second part of the workshop is to discuss what health is really about. We live in the most affluent country in the world, yet we usually don't even rank in the top 40 in terms of life expectancy. So we've got to ask ourselves why that is. We have all kinds of issues, from back pain and hospitalization to diabetes reaching epidemic proportions. The numbers just get worse every year. So in our approach here, we definitely don't have any shortage of drugs or surgical implementation. So we have to ask ourselves, why are we not getting the best outcomes for our dollar? And quite often, it's because a lot of people tend to see a lot of pharmaceutical advertising. So we're one of the only countries in the world you can actually have direct drug to patient consumer advertising. We might be one of 2 nations in the entire world that even allows this. So the tendency is everything that hurts, there's a reactive model of taking a drug for. Now, we're going to revisit this once we understand a few basic concepts. The one that applies to chiropractic offices a lot and extremely common is arthritis. We think that, people who have arthritis have to have it. It's just one of those things that's normal. It's so prevalent it has to be normal. But we fail to recognize why this happens. We also think certain childhood conditions, from ADHD to autism to allergies to later in life, things like headaches, digestive issues, menstrual issues, sleeping issues, reflux, they're all normal. Later on in life, things like cancer and again, arthritis. So one statement that might help anchor this a little bit is saying, and we'll think if it's true or false, is are symptoms the indication a person is healthy? Yes or no? So if someone thinks their symptoms is the indication itself that they're healthy or not healthy, now we're just going to focus on reactive care. So for example, if someone has no high blood pressure, are they healthy? Or no symptoms? Can they have high blood pressure, as an example, and have no symptoms? Can they have cancer and have no symptoms? Can they have no back pain yet, but have a back issue? So if we look at symptoms alone, we're only going to focus on this model of wait till something's broken, then treat it. Now, health is actually your body functioning well. According to Dorland's medical dictionary, it's a state of optimal function, physically, chemically, emotionally. So if our body's functioning 100%, then we know we're in a true state of health, not just asymptomatic. Now, the body system that controls all other bodily systems is our nervous system, your brain and your spinal cord. So if you look at a picture of a brain, you'll see there's a spinal cord that shoots down our spine and branches out with all these nerves to every cell, tissue, and organ in our body. Now, if we have 100% transmission, right, everything's working well, the nerve supply from the brain will control all those tissues. So your arm will function well, your lungs will function well. You can run because the muscles in your hips and legs are firing well. However, if there's some sort of interruption to a signal, something's pinched, the nerve will not flow 100%. So in the case of this illustration, you might have a patient who has great nutritional habits, yet complains of acid reflux. The guy says, hey, I'm taking 0 medication, I eat great, he's organic, it's clean, he's not snacking late night, no processed foods, and yet has reflux. Well, he might be able to rule out the chemical component of his lifestyle, but not the physical. Maybe that patient has a chiropractic exam, and while examining the mid-thoracic area, we find something stuck, something that has spasm, something inflamed, something that hurts the patient to touch and is limited in movement during our exam. We know something's wrong. And if we take some imaging, we can validate this, we can see there's some sort of problem at, let's say, T6. That's the nerve supply segment that goes to the stomach. So now the patient might have stiffness, tightness, or pain maybe in his mid-back, or he can have something like digestive issues, which you can take all the Tums in the world, but if the root cause is coming from his spine, it won't resolve until he fixes that. Now, this process happens when there's a luxation, a slippage. We call it a subluxation. A vertebrae can sit in place, and when it shifts, it can irritate the nerve supply, whatever structure is in there. And there's a whole lot of ways we can shift our spine, but that subluxation will cause some nerve dysfunction. Now, how important is this process of allowing proper nerve supply? So we'll use this triangle to kind of look at the priority values. So let's start with food. We probably can't live more than a month if we're hydrated without food. So food's obviously very important. Probably can't live more than a week without water, even if we're fed. In terms of oxygen, you probably can't live more than a few minutes if you cut off air supply. And lastly is our nerve flow. If someone has a traumatic injury to their spine, right, or there's something lacerating the spinal cord, you will not have any life support, any life flow, no energy flowing in your body, and that can result in instant death. So in terms of like a hierarchy list, you'll see food, water, air, really important, but brain function is number one. The nerve supply regulates everything else, lungs, heart, so forth. So what causes these symptoms, this mechanics of some structural misalignment, can be as simple as, and what does it actually create for the patient? What symptoms will they feel? Well, they can develop headaches, fatigue, neck pain. They can develop digestive issues. But as mentioned earlier, someone can have no symptoms at all and not even know it until they had a thorough checkup, because the symptoms haven't manifested yet. If there's mild nerve irritation, the patient might say, hey, I'm a little tight, I want to kind of stretch it out, work it out, but they don't have anything that's built that bad yet. they won't see these overt symptoms until it gets worse. So what causes these to happen? Well, these subluxations will occur when we have falls, when we have birth traumas, be it aggressive pulling, forceps, whatever it might be, sports injuries where we get jolted pretty hard. You can have car accidents, poor lifting techniques, bad posture and slouching ongoing. And in terms of what this looks like in real life, I'm going to use car accidents as an example because they're so prevalent. You could have a car accident when you're 17, and let's say you have a motor vehicle crash, you hit somebody. You'll see in the illustration the person struck their forehead against the dash. So, an EMT shows up or whoever, they go to the hospital, maybe they need some stitches, maybe they'll get some sort of prescription medication, and that's it, they call it a day. Maybe they didn't take any x-rays or anything else. So, a few weeks go by, they feel a little bit better, but now let's fast forward 20 years. Because for that strike to the forehead to happen, there had to have been a whiplash, a significant enough elongation of the neck for the forehead to smash the dash. That's a whiplash. So 20 years later, it might look like now that patient who was 17 is now 39, 40, let's say, and they're at an orthopedic visit, and they're getting a checkup, and now they're complaining of neck pain, migraines, and let's say carpal tunnel syndromes. Well, that could have been the impact of holding the steering wheel, having their head strike, and really never having that detected or corrected 20 years earlier. So now they might get more medication for the migraines and headaches, maybe some shots for the wrist and the neck, and ultimately, if that fails, maybe some surgical procedure. And if you fast forward another 20 years, let's say the patient's 60 or even beyond that, now the patient's having issues, weight bearing, walking, the headaches have lingered, now they're getting imaging that reveals they have significant arthritis. So now it's one of those diagnoses, well, there's not a whole lot we can do anymore. Maybe they're going around that same circle of getting drugs, shots, surgeries, whatever it is. But really, a lot of this could have been prevented even when that young person had that first car accident and wasn't that symptomatic yet. Because if they could have structurally worked on their spine early on, it might not have led down that entire progression, especially if they weren't that symptomatic. So in summary, the biggest thing is this. Just because a condition is common, arthritis, doesn't make it normal. Cancer is common. That's not normal. No degenerative process is normal. If you have symptoms, something's definitely not normal. There's no way you can have my normal migraines, my normal back pain, my normal sciatica. It is entirely abnormal to have pinched nerves, to have spinal dysfunction, to have degenerative joint disease. So the goal from a chiropractic standpoint is find something early so you're not dependent on these more invasive procedures later on, being proactive versus reactive. Any questions, let us know. Otherwise, try to get a little bit of some home application with the trigger point therapy sessions. If you're a patient, hopefully this helps you kind of speed up your care and response. If you're not a patient, hopefully bring some awareness to what's going on with your body, especially not just if you're tight, but if you have lopsided tension. We look forward to hearing from you.